You came to this video, the algorithm brought you to this video because you are probably having surgery sometime soon in the near future. I'm Dr. Hassan. I'm a board certified trauma anesthesiologist. I'm going to walk you through what you should expect in the operating room, before the operating room, in the operating room, and after the operating room. More commonly than not, you're going to meet your surgeon first before you have surgery, unless it's what they call an emergency surgery. In this situation, it's your job as the patient to ask a lot of questions. Here are some of the questions you should ask your surgeon so you can better understand what's going to happen during your surgery. Number one, you want to ask your surgeon how long the procedure is going to take. This is important because if you know how long it's going to take them to do your surgery, you will have the ability to compare that to other surgeons and other people who have had a similar surgery to what you're having. Now, if you know that a breast implant takes usually 90 minutes to 2 hours, if your surgeon tells you it's going to take them 3.5 hours, that might have a little bit of a red light go off in your head. Of course, this doesn't take into account the complexity of your specific surgery, but at least if you have a baseline for 95-98% of the surgeries that you're having, then you're able to compare that surgeon to other surgeons. Next, you want to ask how long it's going to take to heal from the surgery. This is important because you want to get back to your daily life and your daily activities. Probably not having the surgery because you want it to be the end of your life. So you want to know how quickly you can get back into the routine day-to-day things. This is also important because if the surgeon tells you it might take 2 weeks, 3 weeks, 1 month before you're back to normal, and then a friend of yours tells you that their surgery, when they had their breast implants, they were back to normal within 2 days, a red light might go off in your head. Hey, maybe I need to go see some second opinions. Number 3, you want to know if the surgery itself is going to impact you in the future. What do I mean by this? Well, if you're having an orthopedic procedure, if you're having some sort of bowel resection, anything like that, you want to know if it's going to impact the rest of your life. A lot of patients go into surgery not understanding what the ramifications of the procedure they're having will have on the rest of their life. So sometimes when you have bowel taken out of your stomach, you might have what they call as an ostomy, which is a hole in your stomach, which if you didn't know about before you went into surgery would be a big problem after surgery. This is also the case with orthopedic surgeries. If you're having a knee replacement, what percentage of your knee mobility will you get back after surgery? This is also important because you're able to compare that to other surgeons, other patients who had a similar surgery. And then you can find out if the surgery you're having and the surgeon who's doing it is a good fit. Number 4, you want to ask about pain after the surgery. Now, anytime you have surgery, you and I both know it's going to hurt. But what you need to know is, are there other modalities? Are they going to prescribe you pain medications? Are you going to get a nerve block? If you're going to get a nerve block, are you going to get it before surgery, after surgery? When should you expect the pain relief? And then when you get home, how much pain is it going to be walking up and down the stairs? How much pain is it going to be going from your bed to the bathroom? All those things are important because it helps you gauge how intense and how involved the surgery you're having is going to be. And number 5, make sure you ask them what kind of anesthesiologist you're going to get, because sometimes you get the better ones and sometimes you don't. After you meet your surgeon, you're going to get a set of instructions. That set of instructions is going to tell you what you should do the weeks leading up to surgery, the day of surgery, and the day after surgery. This is important stuff because you want to pay attention to the exact instructions they give you, which medications you're supposed to take before surgery, which medications you shouldn't take around surgery at all, whether it's a blood thinner, whether it's something to do with your heart, and which medications you should start as soon as you're done with surgery and back home. Also importantly, in those instructions will be directions on when you can eat last, when you can drink last, what you can eat and what you can't drink, what type of medications are okay before, after, and during surgery. So pay attention to all those kind of things because some surgeons like to give Xanax before surgery. Some surgeons wait for the anesthesiologist to give Xanax. So because of that, there's a big wide array of information out there that's individual to you, your surgeon, your proceduralist, and your anesthesiologist. After you've met your surgeon, got the instructions, now you're leading up to the surgery itself. What do you do the weeks before surgery, the days before surgery? It's very important to keep up with your medications, whatever medications you're on, whether it's for your heart, your kidneys, your diabetes, anything, especially like seizure medication. You need to take those and take them as instructed leading up to the days of surgery. This is important because when you have surgery, if you're not well controlled with your blood pressure, your blood sugar, your seizures, any of those kind of things, it can affect how well you do during surgery and how well you recover after surgery. This also includes modalities like drinking, smoking, doing illicit medications. All these things you should optimize before your day of surgery because surgery itself is a stress test. And during that stress test, you want to be performing at peak performance. And what's peak performance? Well, it's the best ability your body has to make it through the stress test of surgery of a person cutting into you and taking something out. What I do if I was a patient, well, I would take my regularly scheduled instructed medications every single day leading up to surgery. I would also try to eat as healthy as possible. I try to eat as much organic fruits, vegetables, meat, protein, all those type of things leading up to surgery. I'd cut back on fatty foods, on sugars, anything that would increase my blood sugars and decrease my ability to heal. These are all important things that you have to factor in, especially when you're going into surgery itself. Now, the day of surgery, you're going to meet your anesthesiologist. In the morning of surgery, in the afternoon of surgery, whenever you're having your surgery, you're going to meet your anesthesiologist. This is your opportunity to ask them any questions you have about the anesthesia itself. Most people are more scared of anesthesia than the surgery itself. So here's your chance. Ask the anesthesiologist, what What are they gonna do for pain medication? What are they gonna do? What type of anesthesia are they gonna do for you? This is important because there's 5 different versions of anesthesia. Which one are you getting? Are you getting the one that decreases the chance of nausea? Are you getting the one that decreases your chance of blood pressure variation? Are you getting the one that has any sort of remembering? Are you getting the one that's a light sedation versus a heavy sedation? This is your chance. When you meet your anesthesiologist, don't be shy. Tell them everything. We as anesthesiologists have heard it all. We've taken care of all sorts of patients, whether you're high on drugs or whether you have no blood sugar, whether you have a traumatic injury or you have some sort of simple little cyst on your arm you got to take off. We've seen it, we've done it, we've dealt with it. So it's very important that you take this opportunity that you have, ask them any sort of questions that come to your mind. And if you have a list, write it down, because the day of surgery, you're going to be stressed out. The night before surgery or 2 days before surgery, write down your questions for the surgeon, for the nurse, for the anesthesiologist, because you want to be as well informed and you want your partner, your spouse, whoever's there with you to be well informed as well. After that, you're going to get the medications. You're probably going to forget the rest of the procedure itself, but you're going to wake up in the room. In the recovery room, this is your chance to get the pain medications you need. So ask your nurse who's taking care of you, hey, I'm feeling some pain in my left leg, my right shoulder, any of those kind of things. Ask them, tell them, be vocal. Be an advocate for yourself. Remember, for everybody in the hospital, it's a job. For you, it's your life. And when it's your life, if you make it a priority to be vocal about your own needs, you'll get much better attention. Obviously, don't take it to an extreme where you nag and make the nurses upset, but if you have any sort of concerns, any issues that you're feeling when you're in the recovery room, ask. Because in the recovery room, in the anesthesia recovery unit, the nursing ratio is usually 2 to 1. So the nurse is taking care of 1 or 2 patients at one time. On the floors or in the wards, when you get up there, it's usually 4 to 1, 5 to 1, 6 to 1. So your chances of getting your questions asked, your pain treated is a lot lower, and it takes a lot more time than you can in the anesthesia care unit. And above all, if you're optimized before you go up to the floors, you're gonna feel a lot better, you're gonna sleep a lot better that night. And this is the same case if you're in a surgery center, if you're on the way home, you wanna be optimized to your best of ability. If you're feeling nauseous at all, tell the nurse. We have 4, 5, 6 different medications we give for nausea. Obviously, we don't like to give them all because they cause sedation. We can give you more and more medication for nausea until we hit the max. So if you're feeling nauseous, if you don't feel well, if something feels wrong, make sure you're a self-advocate for yourself inside the hospital. Because remember, above all, in a hospital, it's a business. It's not what it used to be. After the surgery, when you're back at home, this is your chance to optimize your healing. How do you do that? Well, number one, you want to get as many antioxidants in as possible. Why is that? It's because during surgery, you're going to have a lot of insults all over your body. Insults mean injuries, cuts, bleeding. And when you have cuts, bleeding, injuries all over your body, the number of free radicals in your body increases. So if you get antioxidants in there, that's going to help the healing process. And above all, what you want to do is improve your chances of having good healing. What else do you want to eat? Well, you want to get orange juice because you want vitamin C. You want to fight off any sort of infections that you have. You want to get fiber because you want to get your gut moving again, whether that's a salad or oatmeal, whatever it is, you want to get your gut moving back to normal. You also want to get some healthy sugars and healthy fats in. What are healthy sugars? Healthy sugars come from fruits. Healthy fats, the best healthy fats are animal fats. And what comes along with animal fats? Well, it's protein. Protein is important for your healing process. Remember, someone cut you open. They might have broken some bones in order to fix whatever's inside your body that needed fixing. Because of that, your body's going to take 2, 3, 4 weeks to heal back to normal. What you want to do is provide ample supply of nutrients for your body to heal afterwards. So figure out what's best for you. Obviously, if you're a diabetic, you're going to have a different diet. If you have a high blood pressure, you're going to have a different diet. But you want to figure out what the best optimum diet you can have after surgery to help you recover and get better and get back to your normal life. I hope this video is a little helpful at giving you insight what to expect when you get inside the operating room. If you like this video, please do me a favor, share, and please hit the notification button. I try to do this in my off time. I love you guys. I do the best that I can. And if you can help me out by sharing my channel and making it grow bigger, I'd truly appreciate it. I love you guys. I'll see you on the next one.